Yeah, thank you. Thank you so much, madam. So, as I said, I would like to take this opportunity to speak a few points regarding Dhara therapy and Dhara therapy, its principles, practice, and clinical applications. And as we know, the Dhara therapy is something which is being practiced so much in Ayurveda, especially in Panchakarma. Dhara is being practiced so much. Mainly, we can see a lot of practice of Dhara therapy in South also. And there are a lot of methods of practicing Dhara therapy. There are different mediums of doing the Dhara therapy. And there is a scientific basis of doing the Dhara therapy also. And choosing of materials also, there is a scientific rationale behind it. So we will be going through the rationale behind doing the different kind of Dhara therapies. What are the different clinical applications of Dhara therapy according to different acharyas and according to the doctors, Panchakarma doctors who are practicing nowadays. So you can see some of the discussions regarding that. And while we speak about Dhara, we cannot ignore Lord Paramashiva. Shiva is a person who loves Dhara therapy. Not therapy, Dhara. He loves Dhara. He's a Dhara Priya. That is what we say about Lord Shiva. And it is. I am considering myself lucky to mention his name while we conduct a program from the place of Kashi, like BHU. So, why anybody know why Lord Shiva likes Dhara? There is a story behind it, right? So, while there was the Samudra Matana was being done, and Devas and Asuras were trying very hard to get the Amrita, etc., from all the celestial nectar from the ocean, and there came the Kalagoda Visha. And what did Shiva do? Lord Shiva took the Kalagoda Visha and he drank it. And you know the story behind that also. Parvati, Mother Parvati, hold the neck of Lord Shiva so that it doesn't go inside. And all those things we know about it. But what happened after this was that the body heat of Lord Shiva increased a lot. That is what is being said. And so what happens is that then all the Devatas gathered together and they started to do Dhara to Lord Shiva in order to cool his body. So that is the mythology behind Dhara therapy, right? That is why Lord Shiva is called as Dhara Priya. So it has a divine story behind Dhara. And while we see in the history, there is also a method called waterboarding. Waterboarding is a Spanish technique of pouring water over the head of the prisoner. You have a prisoner, you want to extract some information from the prisoner. What they do is that they take the prisoner, they put a towel on the face of the prisoner and they pour water on top of the head of the prisoner. And it is a torturing method. And what happens is that at the end of, say, some minutes or hours of doing this particular torturing, the prisoner will speak out whatever the information is required from the interrogator. So that is a torturing method. And we have the Dhara Chikitsa, which is a very nourishing, which is a very feel-good thing, which always patients say when we do Dhara therapy. Even when people come from abroad for doing Dhara therapy, we can say that they really like Dhara therapy. So it is a kind of nourishing, it is a soothing kind of therapy. So we can see a nourishing type of a positive aspect of water over here, Dhara therapy over here. So there is a negative aspect of this, not a kind of Dhara therapy, but a kind of the waterboarding, which we say about it. And there is also a nourishing kind of aspect to this that is called the Dhara Chikitsa. That is what we are going to speak about. So fundamentally, we're speaking about Jala Mahabhuta. Jala Mahabhuta has got the capacity to distract as well as to nourish. We know about we cannot live, like when a person is there living and if he is left without any food, he can live for say 10 days or 15 days, but he cannot live for a couple of days even without water. That is the importance of water. And it is very nourishing in nature. And in fact, we can see the destructive nature of water in the nature like that in the form of tsunami, etc. Right. So many different forms of nature we can use, we can see, and how it is causing effect on the human body as well as the surroundings altogether. So coming forward or going forward regarding Dhara Chikitsa, we know the Dhara Chikitsa is extensively practiced, as I said in the beginning. But as I am coming from Kerala, I can say that there are certain Vaidyas in Kerala who developed or improvised upon this Dhara Chikitsa. In Rathris and all, we can find Dhara Chikitsa in Dravasveda. Okay, we can see Varshaniga, Pranaliga, we can see about Avagaha Chikitsa, we can see about Parishek, etc. over there, right? So there is this concept of Takradara, which is being developed by Kerala Vaidyas, actually, and you can find references to that in Dhara Kalpam as well as in Sirisega Diviti, which was written by one Pudiyartha Raman Menon. So that is a recent kind of, he actually died during 1950s or 1960s. That is a recent kind of book which was developed by the Kerala Vaidyas. So there is a tradition in Kerala who, some kind of Vaidyas who worked upon this Dhara therapy, and they developed different methods by which Dhara therapy can be administered to the people. So while we speak about it, it doesn't go without saying that there is this kind of Kerala Panchakarma, one particular naming is there, which I don't think it is actually something, it is a misnomer actually, right? Because Panchakarma is something which is practiced all over India. It is the same. So for marketing purposes, people have it as named it as Kerala Panchakarma. There's nothing like Kerala Panchakarma. Everything is a Panchakarma is the same whether it is practiced in south or north, east or west. Like I have worked in Kerala, I have worked in Guwahati in the northeast. I have been in Jamnagar, I have been in Delhi. So Panchakarma is the same, but the way in which people perceive it is different because of the different marketing strategies. So that is another aspect of it, but still, and yeah. So while we speak about Kerala Panchakarma or Kerala Kriyakramam, there is a typical terminology called Kerala Kriyakramam, where we can find 5 procedures. One is Murdha Sega, Kaya Sega, Pinda Sweda, Shiroleba, and Analepana. These 5 procedures are called as Kerala Kriyakramam. Okay, so Murdha Sega, this is actually, we can find references to this in Sirisega Diviti also. So while we speak about Murdha Sega, it is not mentioning about the Tailadhara especially. Here Murdha Sega actually refers to Takradara. Then comes Kaya Sega. Kaya Sega can be taken as Pirichil. Pirichil is a kind of Kaya Sega with oil. That is what Kaya Sega means over here. Then Pinda Sweda. Pinda Sweda is the Sankara Sweda, we know about it, but Pinda Sweda over here mentions to that of Shashtika Shali Pinda Sweda. Then comes Shiro Lebam, which is also called as Tala Podichil in Malayalam. Tala Podichil is Tala is head, and Podichil means covering the head. So that is Tala Podichil, and it is also called as Shiro Lebam, and we do it in different conditions, where we'll be speaking about that also. Shiruleba is usually, to be saying in a nutshell, in conditions where we cannot do Takradara, we can do Palabodachal or Shiruleba. That is what simple explanation of that is. On improvisation, which Kerala Vaidyas did. Then Analepana. Analepana is that of application of like paste of Shashtika Shali. You prepare a paste of Shashtika Shali. Instead of preparing totally, you you rub the paste on the body. That is what we do in Analepana. So we have Murtha Sega, Kaya Sega, Pindasveda, Shiruleva, and Analevana, which may be mentioned as Kerala Kriyakarma, which may be said as methods or techniques developed by certain Kerala Vaidyas. And we also have Abhinava Dhara, which is a new method of doing Dhara Chikitsa, which often foreigners do. They have this portable Dhara Yantram. They have this kind of thing which they have developed, where you can carry it in your bag, and you can pour any kind of liquid inside it, and you can keep it on your head, and you can lie down, and this automatically comes on top of your forehead. So this is a new kind of Dhara therapy which is being developed by some of the foreign companies, and this we should be wary about this, because you know what, once we are able to explain our Ayurvedic principles and all, and once we are able to vouch for it, these actually belongs to India, then only we can protect it. The foreign people, what they're trying to do is that they're trying to get the principles of Ayurveda or understand the methods or applications of Ayurveda by which they can modify it according to their needs. And they are also trying to patent it. So those things shouldn't be allowed actually while speaking about it. So just in case, I came across this particular Dhara machine, automatic Dhara machine was developed. So that is the reason why I mentioned regarding this. So while we speak about Dhara, like I said in the Brihatrays, there is mention about Parishegam and Avagam and all. And there is also different methods of application of heat which is being mentioned in our by our Acharyas. Like we have mentioning about say Pinda Svedas, we have mentioning about Jintaka Svedam, Kuti Svedam, we have mentioning about Parishega, Avaga and all. So what is the fundamental difference while we speak about all those things? This is basic physics while we speak about it, right? One is conduction, convection, and radiation. Everybody knows regarding this. While we speak about conduction, conduction is nothing but direct heat transfer through contact. Like while we use a hot material and we make contact with our body, that is conduction. You conduct the heat towards the body. And this is what we do while we do the different kind of Pindas Vedas. When you're preparing a Churna Pindas Vedam, while you're preparing a Shattika Shali Pindas Vedam, or even a Patra Podalas Vedam, you're preparing a particular hot bolus. You're heating it on the top in a kadai, and then you put it on top of the patient. That is a kind of conduction heat, right? So there is a convectional heat. What is a convectional heat? Where heat transfer is via fluid movement. That is what is being done in Parishega. You make a kada or you make a warm oil and then you pour on top of the patient. That is a convectional heat, convection heat. So the heat is dissipated in this particular method of application of heat, right? It is not, there is no direct contact of heat over there. The heat is dissipated. It is a mild form of application of heat. Then there is radiation. Radiation is where the heat is coming through electromagnetic waves. Like while we say the patient to sit inside a kuti or a Jaintaga kuti's hut, where we have learned about the Jaintaga Svedam and kuti Svedam in our classics. So there the electromagnetic waves comes, the heat waves comes, and it makes the patient perspire. So this mechanism can be thought about in the infrared. We also use infrared in treating of the patients also, right? That is the kind of the most ruksha kind of ruksha Svedana we can say about it. Like while we speak about Svedana also, it is going through a spectrum from rukshada to snigdhata. Say we can say that Valuka Svedam is a kind of ruksha Sveda, then comes the Churnapinda Svedam, then Patra Potala Svedam, and it gradually becomes snigdhata. Then the Shakti Shalipinda Svedam, all these things becomes more snigdhata in nature. So there are different methods of inducing intensity of heat or quality of heat while you do different Svedana procedures. So the materials which we use in preparing the Svedana material decides the quality of heat. Like we have a fan. Fan is something which rotates and gives us the wind, but there is a regulator which manages or manages the intensity of the rotation of the fan. Right. Similarly, Svedana is a procedure, and we have different materials by which we can quantify or make changes in the intensity of the heat. So Acharyas has very intelligently designed different kinds of Svedana procedures. So that is the reason why we speak it on the terms of physics, we have conduction, convection, and radiation. Conduction, as I said, while we use a hot bottle and apply on the body, that is conduction. While we use a warm liquid on the body, that is convectional heat, and radiation is the other kind of things. So while we speak about convection, while we think about convectional heat, we can find many different methods of application of Dhara therapies, which is being mentioned, especially in Vadarakta Chikitsa, right? While in clinical situation also, while we do therapies, while we do Panchakarma therapies, we do not prescribe any kind of potli Svedas directly for a patient who is having any kind of tenderness. If there is any pain, if the patient is not allowing a doctor or a therapist to touch a particular part, you cannot do a potli Sveda over there. But you can do a Dhara Chikitsa over there. That is why Acharyas has said about in Vadarakta Chikitsadam, the Dashamula Kshira is a Sadishula Nivarana. Right. So it helps in reducing the tenderness, especially. That is what the simple thing, the thought process which should go behind it. So that is the reason why Acharyas has said about different kind of Kashaya Dharas, Taila Dharas, etc., where maybe we can say that if there is a kind of Pittanabandha is there, any kind of inflammation is there, then you can go for a kind of Dhara Chikitsa. So that is the reason why different methods of application heat is being mentioned over there. And there is also dynamics of Svedana Karma. While, as I said before, while we apply the Pinda Sveda, there is a direct heat application, there is a direct contact, there is a localized application of heat. And while we go from Pinda Sveda to Drava Sveda, the heat is dissipated, heat transfer is dissipated, diffusion of heat is happening over there. And while we go to Kuti or Jintaka Sveda, etc., there is further diffusion or the spreading of the heat. So the mechanism, there is a physics behind it. So there is a reason why Acharyas has said about all those such things. Okay, so that is something which is fundamental about thinking about different kind of Dhara Svedana Chikitsa actually. But still, while we speak about Dhara Chikitsa, this comes into your mind for consideration. Okay, then we go to our topic, which is Dhara. Like I said, while we say about the Dhara, it is being mentioned as Takradhara and Keraliya typical Chikitsa. Okay, so there are different methods of questioning regarding, do we need to Dhara in a specific point on the forehead? Should we need to move the Dhara, the flow to and fro across the forehead? Many different questions may arising. Some people may say that you need not move it to and fro. One single point is enough. Many people will say that is not enough. So there is a reference in Sirisega Dividhi, ki Dharaya Padana Dreyafaha Kagaro va Yatha Bhavet. Means, that is in Malayalam, the the flowing of the liquid should be in the shape of Ra or Ka. You can see the shape in the images given below. It should be in the shape of Ra or Ka. Many of my friends who come to Kerala or read the Malayalam, the lipi, the letters, and they say that it is like jalebi, right? You can also see that it is like a jalebi you can see over here on the forehead. So that is actually a kind of thing where the movement is like kind of to and fro. When you see the movement of Ka or when you see the movement of Ra, it is actually a to and fro movement. So that is actually the reference for that. You should do a to and fro motion while you do the Murtha Segam. That is something which we should always keep in our mind while you do the Dhara Chikitsa. Proper reference is there regarding this. And there is also a thing by which I think many of you must have also heard about it. There was a study which was done by a Japanese scientist called Uebaba, something like that. And he developed a robot who can do the Dhara Chikitsa, not Takradhara, Taila Dhara. He developed a mechanism by which Taila Dhara can be done by a robot. And he measured the EEG of the brain of the people who is undergoing Dhara Chikitsa. And what he found was that the electromagnetic radiations of the brain will be the same as that of a person who is doing meditation. Such is the amount of calmness which can be obtained by doing the Dhara Chikitsa. That is something very wonderful actually for the scientific community to see from a different perspective about the Dhara Chikitsa. And like I said, while we do the Dhara Chikitsa, there are different methods, different materials, many different materials are being prescribed by Acharyas while we are speaking about the Dhara Chikitsa. Acharyas have said you can use Thailam, you can use Ghritam, you can use Takram, you can use Kashayam. Kashayam is the decoctions, medical decoctions. Even you can use Jalam. Jalam is something, water, plain water. We will be speaking about it when we can use such things. Naligerodagam is coconut water. Kshiram is milk. So many different mediums can be used to do different Dhara Chikitsa. We will be going through this gradually. And so while we speak about Takradhara, like we have mentioning about Takradhara and Dharakalpam also, but I find the mentioning about Takradhara and Silasega Diviti a little bit easy to, especially for students who is studying about Takradhara. 3-line sloka is there. Klama Bhaji Shirodaha, Drujon Moda Pramahinam, Katha Pitamayartanam, Vidreshan Shaside, Shirsa Takrayuktana, Ratri Kwadana Sejana. So only 3 line is there. And you can see the dosha involvement which is being considered while we do the Dhara Chikitsa over here. That is Kapha Pittamayartanam. Kapha Pittamayartana means something which is done where in conditions there is more of Kapha or Pitta. So never in your clinical practice you should do Takradhara in Vatika patients, right? So simply in clinical mechanism, while we speak about it, we say that we do Takradhara in conditions where there is sleep disorders. Okay, so in that also we must see the Amshamsha Kalpana over there. While we speak about a patient is having sleeplessness or disturbed sleep, there is a different conditions. Why a person is having sleeplessness, chronic sleeplessness, Vata will be there. Vata involvement will be more over there. You shouldn't do Takradhara over there. You should do Tailadhara over there. But a patient is having disturbed kind of sleep, there may be Pitta involvement over there. If you see Pitta involvement over there, you can do Takradhara, right? So even in more amount of sleep, excessive sleep, you can do Takradhara also because Kapha involvement is more over there. So many different methods by which you can understand the clinical condition and apply the Takradhara appropriately. Usually, we consider Takradhara as Shidaruksha and Shoshana Stambhana in nature. And that is the reason why Takradhara is also done for a patient who is having psoriasis. A patient is having psoriasis, oozing kind of psoriasis. And in such kind of psoriasis, you can do Takradhara. It causes drying of the lesions. Initially, in the initial stages of patient who is having such conditions, you can do Takradhara. Even for patients who is, it is also said to be something which increases Agni. That is what Dharakalpam says about Takradhara. So when you are going to do Snehapana for a patient, you can do Takradhara in the beginning to increase the Agni also, provided there is no Kevala Vata condition over there. Okay, so one important thing which I like to remember over here is that Acharya has said that after doing Takradhara, you can do Gridapana. You can say the patient will take Grida in Shamana doses. That is something people doesn't do much often. The reason because is that Takradhara causes, it is Shida Ruksha in nature. So there may be a chance of increase of Vata. So to balance that, Acharya has said that you must give Grida in the end of the, say you're doing 7 days of Takradhara. At the end of 7 days of Takradhara, after it is finished, you can keep a period of Grida Panam for the patient. It may be given a Shamana dose. That is enough. Okay, and there is also many different confusions regarding Takradara. Should you do Taila Abhyanga before doing the Takradara? Can you Takradara be done all over the body? Many different opinions are there regarding this. Should you use Niramla Takram? Should you use Amla Takram? Many different things are being discussed nowadays. Like when we say about Sirisegadividi says to use Anamla Takram, while Dhara Kalpam says to use Amla Takram. So there is a difference in doing the selection of takram also, according to the acharyas also. Of course, Dharakalpam is something which is very old, and Sirisegadividi is something which is new, but still there is a difference of opinion in that. And there is an explanation for this, like people use Amla takram in Kabaja conditions. In Kaba Pradhana Rogas, you can use Amla Takram, and in Shirodaham, or where there is Pitta involvement is more, you can use Niramala Takram. That is something which some of the acharyas give explanation for this, like that. Why Dharakalpam is saying about Amla Takram, and why Sirisegadividi is being saying about Anamala Takram. And that is being decided over here. And there is also different methods of preparing Takram and milk, preparation of milk, and the milk is converted into takram, which is being used for takradara. So many different materials. Usually we use musta for preparation of takradara, which obviously is very good for kapha pradhana rogas. You can use yashti madhu, which is good for pitta pradhana rogas. And there is vadanibandham, kapha vadanibandham, you can use vilva moolam. There is pitta vadanibandham, bala and shatavari is being used. This is something which is being used by different acharyas, and there is references for this in Sirisegadividi also. So many different methods by which we can prepare takram, and which we can use in different conditions. And also, while there is a question regarding should you do abhyangam on the head before doing takradara, acharyas has said that you must do abhyangam on the head before doing takradara. Even some of the old acharyas also used to say that you can do abhyangam on the body as well as the head and then do the takradara. So some opinions are being like, maybe it is being said like that in order to protect our body from vata pragopam. That may be the reason that it is being said like that by the acharyas. But some people do practice, some people do not practice that. So there are also different methods of preparing takradara, different variations are there. I'm mentioning a few of the variations. Okay. And you can find about Araggodadi Takradara. Araggodadi Takradara. We also prepare takasa. I think it is very common to have Araggodadi Kashayam and then we mix it with it, the Amla Kwadam, and then that is used for preparing takara for conditions where there is skin conditions where there is kaba involvement is more. So that is simple method of Araggodadi Takradara. So there is a particular method of Araggodadi Takradara where you prepare Araggodadi Kashayam in this manner. You use Araggodadi Ganam, you add Yashti Madhu into it, and then you add a triphala into it, which is 10 grams each. You add all these things in 4.8 liters of water, reduced to 1 liters of kashaya. Boil and reduce to 1.2 liters of kashaya. That is the preparation of kashaya. And then there is preparation of takra, where panjagandha churnam and musta churnam, 40 grams each, are used, and they are put into a potali, and it is dipped into the milk, 1.2 liters of milk. You add 4.8 liters of water into it, you boil and then reduce it to 1.2 liters. And then that is being used for preparation of takra. That milk is being used for preparation of takra. So this kashaya and takra is being mixed as a third step, and then it is used for dhara. And it is being said that it is good for kapha-pitta conditions. So once variation of takra dhara on Araggodadi takra dhara, in many skin conditions you can use this. It is not so common, but something which can be used in some of the clinical conditions. Then there is another method of takradara which is also called as Dwadashamradam takradara, where you prepare the kashaya by adding amalaki 180 grams. There is pulinjarambu. Pulinjarambu in Malayalam means the vein of the tamarind. You have this pulp of the tamarind, and then you have the vein. The vein of the tamarind is being taken, and then you have water. And we boil and reduce it to 1.2 liters of vata. And then you have a method of preparation of takra where you have almost 10 ingredients. Musta chandanam, rekta chandanam, ambu, sevium, madhugam, aguru, devadaru, belagutta, all being taken in the amount of 12 point, equally taken. You make into a potali, you dip it in the kshira, add water and reduce it to the amount of kshira, and then you make takra with that particular kshira. It is said to be Vata Pitta Kabaharam, but it is seen to be more of a kind of Pittahara in nature. and it is very good for sleep disorders, and it is also being said very good for Vadarakta conditions also. That is Dvatashamradam Takradara. That is one kind of Takradara which is being mentioned. And then how much time can you do Takradara? That is the Kalam of doing Takradara. That is one of the things which we must keep in our mind. Usually we do Takradara for say we do Takradara for 30 minutes, or maybe we will be doing it 20 minutes. There is variations regarding this, but Acharya has said that you can do Takradara for 60 minutes. Okay, so you can do Takradara, but in a Avarohana Kram, sorry, not Arohana Kramam, and you can do an Avarohana of that also. You can start with 30 minutes, you can improve it to 10 minutes, next day 40 minutes, 50 minutes, 60 minutes, and then come down also. There is a mention regarding this also. So this is something which is being mentioned regarding the time of or method of doing Takradara while you consider the time factor. Yeah, so while we speak about Jaladhara is something which I had said earlier. We have different mediums of doing the Dhara Chikitsa. So Jaladhara, using water for Dhara. And preferably it is being said you must use well water. Common well, the well water, the ground water should be used for doing Jaladhara, that is being mentioned. And it is being said that you can do Jaladhara in conditions of Unmadam, Madatyam, Madam, Visham, etc. And there were certain Vaidyas in Kerala who used to do this practically, where they used to, they don't have a motor during that time. They have this bucket, they dip it in the well and they take the water out. Each bucket, they take the bucket, 101 buckets of water, not 1001 I have not seen, but 101 definitely used to practice was there. And they take this bucket and pour it on the head of the this thing, patients who is having Unmada, etc. So that is something which was in practice during some period. And some people say that you can do Jaladhara and hypertension, hyperthyroidism, Dept, etc. That is what some of the Vaidyas are of the opinion regarding doing Jaladhara or the Dhara with water. Then we have Naligaradam. Kerala, what is the name Kerala? Why is the name Kerala came? Kerala is something, Kerala means coconut. So we have a lot of coconut in Kerala. So people used to do, some Vaidyas used to do Dhara with Naligaradam. Naligaradam is coconut water. And it is being said as Naligaradam is, or the coconut water is Pitta Shamana in nature. That can be done for reducing Klama and Daha. So some of the Vaidyas say that you must add a little bit of Karpura Churnam into it while you do the Dhara. That is more effective for its for reducing the Klama and Daha. And some people, what they do is that they add milk into it. That is being effective in Kamala as well as in Brahma. That is a reference for that is Yogamrita. So tender coconut water, not plain coconut water, tender coconut water plus milk, known as a Shirodhara in Kamala and Brahma. And there is also mentioning regarding Swarasa. You can use Bringaraja Swarasam. There is Arogya Raksha Kalpadruma mentioning is there, which can be done in Kamala. Bringaraja Swarasa Shirodhara, Naligirodhaga Shirodhara, and there is also plain water Shirodhara. And there is also Kshira Kashayam, Kshira and Kshira Kashaya. You can prepare Kshira Kashaya of different medicines, and that can be done in different clinical conditions. And Yogamridam says that you can do Kshiradhara with Kshiradhara, plain Kshiradhara, not even medicated, but plain Kshiradhara can be done in conditions where there is Arochagam, Asaragdaram, Atisaram, etc. You can do Kshiradhara. Obviously, we must consider that the Kshira mentioned over here is that of cow's Kshira, right? And there is also Kshira Kashayam preparations. Some people say that you can use Panchagandha Churnam. You prepare Panchagandha Churnam for Kshira Kashayam, and it is very effective for doing Dhara and reducing hypertension. The Shamula Kshiradhara can be done in Vadaja Shirashula, Ushira Kshiradhara in burning sensation. If any burning sensation is there on the body, then that can be done. Shatavari Kshiradhara, which is being done in menstrual problems or PMS situations. Madradhara Vyadiganam can be used in multiple sclerosis. Guduchi can be used in diabetic neuropathy. Guduchi in diabetic neuropathy is very much established according to some of the modern researchers also. So these are the different varieties of Kshira Kashayam preparations, and it can be done in many different conditions according to the yukti of the Vaidya. Okay, and Kshiradhara, of course, it cannot be done in conditions where there is Kapha and Ama Visheshan is there. So you must very selectively use the appropriate kind of Kshira and Kshira Kashayam. So Roganam, Avasthanam, Vedam Pradhanam. The Avastha of the Rogam is also important. While we say about, Acharya has mentioned about Jwara, Acharya has mentioned about Vatarakta or Vatavayadi instead, whatever it is. So while we see the Jwara Chikitsa also, there are certain situations, avasthas on which we use Kashaya, avastha on which we use Dhrida, avastha on which we use Vasti also. So Roganam, Avasthanam, Idam, Vardhanam, and we must consider that. And of course, we consider Yogi, Rogam, Balam, Analam, Prakriti, Vaya, Sattva, all these things we consider. But considering all these things, and according to the yukti of the doctor, you must select the appropriate kind of medium and appropriate kind of sanskara. You must add appropriate kind of medicine into it and prepare the medicine and use it according to the condition of the patient, avastha of the patient, and that will be very effective. So while we speak about Takradhara, Tailadhara, and Kshiradhara, we are speaking about Shirodhara, okay? So as I said before, Takradhara is Shida Ruksha in nature. Okay, Takradhara is Shida Ruksha in nature, and it balances Kapha, Pitta, etc. And never it should be done in Kevala Vatika condition. It is cooling, it is Shida, it is calming in nature. Okay. And while we speak about Tailadhara, Tailadhara is Snigdha Ukshna in nature. It balances Vata. It is done in conditions where there is Vata is more. Okay. And Kshiradhara. Kshiradhara is what? Kshiradhara is Shida Snigdha in nature. And it is done in conditions where there is more Pitta imbalance are there. So accordingly, you can select. This is a rule of the thumb while we select Takradhara, Tailadhara, or Kshiradhara. Okay. So that is the importance of selecting different materials or mediums while you do the Dhara Chikitsa. Then there is a modern research which says that, you know, everybody must have heard about emissary veins. Emissary veins are the veins which connects to the scalp. And this goes and connects to the transverse sinus and to the interior of your brain. There is connection of this to this great cerebral vein, etc. And so any infection is happening to this is actually modern research. Any infection is happening to the scalp. If that infection is reaching the emissary veins, that infection can reach the brain and the cerebrospinal fluid, etc., etc. So this is the explanation which is being done while we do the Dhara Chikitsa. That is according to some of the Vaidya, some of the scientists, that while you do Dhara Chikitsa or any Chikitsa on the forehead, on the head of the patient, that particular Chikitsa or that particular medicine may get absorbed through the emissary veins and it may act upon the brain directly. That is one explanation which is being given by some of the doctors or doctors, not Vaidyas. But still, there are not enough evidences regarding this absorption of oils or something. This is still a controversial topic regarding absorption of oil while you do Dhara or Abding or whatever it is. Some people say that there is absorption of medicines or active principles while you do the Abdingam or Dhara or whatever it is. Like stratum corneum is one of the toughest layer on the skin. It protects us from many factors. If stratum corneum is so weak that it can allow certain materials to pass through it, then certainly one will fall ill. So there is a controversy over there. People say that things cannot permeate through stratum corneum. But still there are also some people who say that when you use a lipid medium, it can form a kink structure. This kink structure can change the structure of stratum corneum, the layers which is guarding the skin, and then it can let inside some of the active principles into it. And there are certain studies which is done with essential oils, and they say that active principles are being found in the body. There are also certain studies which shows that especially newborn babies, early born babies, those who are not completed the full term, preterm babies, and there are certain studies shows that when you apply oil on the preterm babies, you can find the active component of that essential oil in the blood of the baby. So those are the modern studies is going on, and still we do not have enough evidence to show that there are significant amount of active principles is being absorbed while you do any kind of external therapies like Abhyangam, Dhara, or whatever it is. But still, this stands that there is this emissary vein is there. And this may be the reason why while you apply a kind of, if anybody have used some Rasnadi Churnam, there is a sanskara in Kerala that while after doing snana, after doing the head bath and all, they will take a little bit of Rasnadi Churnam, they put it on the bregma and then rub it. While you rub it, you can find the smell of the Rasnadi Churnam on your nose. Okay. So there is also this concept of doing talam, etc. in Kerala, and which is not being practiced in much other parts of India much. And that is also something which is to be thought about. There is this concept of talani rakam, that is a different kind of concept which is not seen in other states of India. But still, that is altogether a different topic which needs to be discussed. I'm not going into all those things because that doesn't come under the purview of this particular discussion. But still, I'm just mentioning regarding this when we spoke about emissary veins. Okay, so some of the studies it shows that there is some kind of delivery of medicines while it is being applied through oil. This is the transcranial route of brain targeted delivery of methadone in oil. While you apply oil, which is mixed with methadone, that methadone is being absorbed into the brain. That is what some of the research study shows. There is also another study which shows that there is also absorption of diazepam when it is being mixed with lipid substances and applied over the brain, or not on the head, on the scalp. So a couple of studies are there which can be taken as some of the evidence shows that while you apply any kind of therapies on the head or on the uttamangam, there is some kind of absorption which may be happening. But still, one of the study was an animal study was done on rats, I believe. Another study was done in healthy individuals, a diazepam study. They found that while they use diazepam with the lipids, what happens is that the sleep latency reduced in the individuals. And the sleep latency reduction means that the people were able to sleep early because diazepam is being used. Okay. So they say that lipid materials improves the absorption of diazepam. So there are also other studies that show that when you apply any kind of material mixed with lipids on the body, on the skin surface also, that is being absorbed also. So many different concepts are there regarding this. And while we speak about Svedana Kriyas also, just I'm mentioning about Talam, a little part of Talam, because we're speaking about Dhara, we'll be covering about Dhara on the body also, especially we'll be covering about Pilichil. So while we are speaking about Pilichil, it is a kind of Snehanam as well as Svedhanam. So Svedhanam is there definitely. So there is this practice of applying Talam on the forehead. And the concept is that while you do any kind of Svedana procedures, even if you do Pinda Svedam in Kerala, they apply this particular Talam on the forehead. Not forehead, on the Bregma. So the concept is that while you do the Svedana procedure, the Shiras is the place of Kavastha. So there will be Vilayanam of Kapam, and it will be not good for the patient. It will be causing some problems. Okay. So in order to prevent that, this kind of Talam is being applied. That is one of the explanations which is being there. And it is especially more applicable in situations where there is more humidity. Like in places like where there is humidity, like Kerala, if anybody have gone to Kerala, you must have experienced a lot of humidity over there. A lot of chance for formation of Abhishanda. There is a chance for Vilayanam of Kapam over there. So that may be the reason why such a practice is there. Okay. Much need to be discussed or research regarding this, but this is what is the preliminary discussions about Talam is there regarding why we do different kind of Svedana procedures. Okay. So again, so there is this concept of psychosomatic dermatology, Urdhamula Matashyaga, that is what we call in Ayurveda, where anything which is being done on the head, it will be acting on the whole over the body. That is what. So this concept of psychosomatic dermatology branch is coming up in modern medicine also. So that is something which is still in its nascent stages. Yeah. So again, while we go to the other kind of chikitsa, which is Pilichil. Pilichil is something which is, everybody knows about Pilichil. You can see the picture of Pilichil over here. You can see the patient sitting, and you can see the two attendants standing on the both sides of the patient and squeezing the oil through the hand and letting it flow as a single dhara, a particular stream on the body of the patient. Traditionally it was being performed not by 2 attendants but 4 attendants. No, not 5 attendants. The patient used to lie down on the droni, and the droni was not a table. It used to be on the floor. The droni used to be on the floor, and the technicians or the therapists used to sit on the sides of the patient. 2 technicians will be sitting on the 2 hand parts, and 2 technicians on the leg parts, and 1 technician will be sitting on the head side to change the oil and all. So that technician will be helping in changing the oil, and he will be passing it to the rest of the therapist, and they will be doing 4 people will be doing therapy, Pilichil therapy for a single patient. So we used to say that it is a kind of expensive therapy. Pilichil was actually invented by Acharyas for Adhyorogi. Adhyorogi Vishvashang Vashyapada Sattavana. That is what Acharya says about the qualities of a Rogi. So Adhyorogi, a patient who is having much money, is a patient who can do a proper Pilichil Chikitsa. Okay, because it is being said by Acharyas that you must use fresh oil every day. That is the best thing to do. But to do a Pilichil Chikitsa, you need at least 4 liters of oil. So it is very expensive. So it is being said it is being prescribed for kings and all, noble people, or the people who are rich. One group of people used to say like this. But again, in Trivandrum Ayurveda College, there is this mechanism, there is method of practice of doing Pirinji Tadaval. I hope everybody will be able to follow what is Pirichil. Pirichil is this chikilsa, Kayasega with oil. You need at least 4 liters of oil for this. But in Trivandrum Ayurveda College, there is a practice of doing Pirinji Tadaval. Pirinji Tadaval is a mechanism by which we can do Pirichil for poor patients. How? Because we will be using almost 2 liters of oil for that, not 4 liters. We need less oil for that. And then you will be applying the oil on the body, and then you will be Tadaval means Pirinji Tadaval. Tadaval means you massage the patient, and then you take the oil from the patient's body, you squeeze it out, and then you reuse it. You will be doing a lot of massage along with the Pirichil. Usually it is not being advised to do massage while you do Pirichil Chikitsa. It is actually a soothing Chikitsa, soothing treatment where you make the oil to pour on the body of the patient. And you need not massage the patient, but you can slightly clean the oil from the body of the patient. But in Pirinji Tadaval, you do this and then you do massage because you need to spread the oil all throughout the body. So that was an improvisation which was done in Ayurveda College. So that was for the poor patients. And again, regarding the oil, usage of oil, some people use new oil every day. That is what is being said, which is for the rich people. But Acharya has said that you can use same oil for 3 days. On the 4th day, you use new oil that can be used for next 3 days. And on the last day, you mix both the batches, and then you have this Kuti Pirichil, that is called a mixed Pirichil we have. So different methods of doing it is there in different parts of our country. But still, this is how it is happening. We will be speaking about Pirichil also. Pirichil is something which is, as I said, it is a Snehana and Svedana Chikitsa, and it is actually something which is highly Vatanilomana in nature. Okay, Pirichil Chikitsa is highly Vatanilomana in nature. And what happens in Pirichil Chikitsa is that in ancient times, what people used to do is that after doing the Pirichil Chikitsa, while the patient is coming down from the Droni, Gandharavastadi Kashayam is being given to the patient. Gandharavastadi Kashayam is something which is actually causes a little bit of laxation of the patient. Laxative, it has got a little bit of laxative action. So what they believe is that while you do the Pirichil Chikitsa, the doshas are being coming from the Shakha to the Koshka, because it is Svedana and Svenehana together. And then at the end of it, some laxative is given so that the doshas are being expelled out of the body daily. So while you're giving 7 days of Pirichil or 14 days of Pirichil, on the same day of Pirichil, after the Pirichil is being completed, immediately garam hot Gandharavastadi Kashayam is being given. That is taken by the patient. The patient passes the doshas out of the body daily. A kind of dosha prachyavanam is happening to the patient. Okay, so that is the concept of Pirichil Chikitsa according to Kerala Chikitsa. Then we have different methods of nowadays people say that we don't want any people. It is being automatically done by machines. And foreign people, they do have this concept of witchy shower, which is being done in France, etc. Yeah, so you can see everybody likes to undergo Dhara Chikitsa. Elephants, they love you. If you have been to Kerala or any part of the country where there are elephants like to do they love to take showers. Okay, you know what is the reason why do that? Because they don't have sweat glands. They have very less sweat glands, and to have some thermoregulation, they do this thing. They play in the water, they play in the mud and all to have some thermoregulation. So that is just a fun fact while we speak about Dhara Chikitsa. Yeah. So again, coming back to the Pirichil or Dhara. Okay. So we say that while we do the Pirichil or the Kaya Sega with oil, we use our hand. We take the cotton, we dip it in the oil, and then we squeeze it and we let the oil to pour out through the thumb as a single stream. And it should be done from a height of 12 angulas. That is what Acharya says. And while we do the Dhara with Kwatha, we prepare the Kwatha, and then some people use Kindi. Kindi is a special kind of vessel, you may be knowing about it, that is being dipped into the Kashaya, and that Kashaya is being poured on the body. They don't use cotton for that. So what do you think why Pirichil is being done with the hand? It can also be done with the Kindi. It can also be done with a vessel. You can dip a vessel into the oil and it can be poured on the body. Okay, why Acharya says that you must use your hand? A simple explanation is there. If you think about it, that is also physics. The specific heat of water is more than that of the oil. Okay, the oil heats quickly and the oil can retain a lot of heat. Okay, and there is a chance for burn by oil if you're not careful enough. If you're using your hand, you're dipping the cotton along with your hand inside, then what happens is that you will be having a sense of temperature with your own hand, and with that temperature, you will be pouring it on top of the patient. So there are very less chances of burning the patient. Burn with oil is very dangerous than burn with water. So that is a simple reason why Acharya has said that you can use your own hand to bring pirichil. Okay, and oil cools down faster than water, and the viscosity of the oil. Okay, so something which is very viscous, it is convenient to you to use a particular squeezing technique. So that is the reason why pirichil is to be done with your own hand. The temperature should be regulated. Okay, so that is the reason why Acharya has said like that. Okay, so while we speak about Dhara therapy, there are different methods of doing Dhara therapy. Like we do Dhara with Kashaya, we do Dhara with Taila, we do Dhara with Kshira. Okay, so Ruksha kind of therapy you want, you do it with Kashaya. It can be done in various conditions of Kabha imbalances, whether this Amavastha is there, you can do Kashaya Dhara, Dashimula Kashaya Dhara, or Panchavalkala Kashaya Dhara, etc. can be done. And if you want the Snigdha Avastha, you can use Kshira Dhara, you can use it is been done in conditions where there is Pitta involvement, is there Pitta Nigandham, Vata involvement, is the Shimula Kshira Dhara. It has been done in such conditions. If you want highly Vata Nilomana Dhara, you can use Taila Dhara. Taila Dhara is highly Vata Nilomana in nature, as I said. It causes the doshas to come from Shakha to the Koshta. And as I said, Gandharvastadi Kashayam is also called as Pati Kashayam because it is being given to the patient immediately after the Dhara is being done, so that the doshas is being expelled out daily. So in Vatika condition, it is being said that you can use Koshna Sneham, and Pitta Rekta association is that you can use Anupna Sneham. That is one reference there regarding this also. And while saying about this, I remember about Takradhara again. Takradhara is being said, many people have differences of opinion doing Takra. Some people heat Takra while they do the Dhara. Some people do it as it is. So there is a difference of opinion regarding this. Okay. So according to the textual reference, Takradhara should be done in room temperature. Like it shouldn't be heated. It is not required to heat the Takra while you do it on the head. But you can do Takradhara on the body while in Prameha, in situations like Prameha and all, you can do Takradhara all over the body. In such conditions, you can heat the Takara if it is required. If the Vaidya seems it is required, he can heat the Takara and do the Takradhara. But while you're doing it on the head, the Takara should never be heated. So again, coming to the textual reference of Kaya Segam with oil. You can find the reference of this in Kaya Sega Dividhi as well as in Dhara Kalpam also. While you see the sloka, you can find very interesting thing. I am Chirajan Nihanti, Ghoran Vridrasi. So all the chronic conditions means where there is specifically Vata involvement is more, the Vata aggravation is more. In such conditions you can use, where you require highly Vata nilomanam. In such conditions you can use Taila Dhara. And what is the effect? Dridhadan karoti dehasya pushtim balam. It increases, it nourishes the strength of the body. Okay, so in conditions where patients we have, like patient who is having stroke, pirichil is very effective therapy. Pirichil is very effective because there is high Vata involvement is there. There is Mudha Vadam Avastha there. You require to have some anilomana to the Vata, and then you require to have some kind of expulsion of doshas daily, and then you require to strengthen the body. So in such conditions, pirichil is very effective. And there are certain prayogas of pirichil also according to some of the Vaidyas. Like we have Ettanna Mukkut. Ettanna means 8. Enna means oil. 8 kind of oils which can be combined together to do a prayoga. Like we have Tila Taila, Kera Taila, Grida, Eranda Taila, Vasa Tailam, Karanja Tailam, Punnaga Tailam, Sarshava Tailam. 8 kinds of Tailas are being mixed together, and that is used for Dhara, for pirichil. And the quality of this particular combination is Ushnam in nature. But the interesting part of this is Rekta Prasada. It is Ushnam, but it is Rekta Prasada. And it is being prescribed in Vatarekta conditions. So that is a particular typical combination which can be done in certain conditions. And there is certain oils like Kaya Tirumini. Kaya Tirumini is very extensively used in Kerala. It is Ushnam, it is Shobhaknam, it is Apigada Shamanam, and there is Murivanna. Murivanna, everybody knows about Murivanna. Murivanna and Gayatrimini are being used in similar situations. But while you see the quality of Gunam of Murivanna and Gunam of Gayatrimini, Murivanna is Shidam in nature and Gayatrimini is Ushnam in nature. But you see the other indications, Shobhaknam, Apigada Shamanam. Okay, but again, Murivanna has been done in conditions where you require Robana, and also in conditions where you require, where there is bones are there, that you can use Murivanna. You cannot use Kai Triveni over there. So in many conditions where the trauma, soft tissue injuries, ligamental strain, and bursitis, Kai Triveni can be very effectively used. It is according to the pharmacopoeia of Ayurveda College. I don't think there is any classical reference to Kai Triveni. So very effective medicine, very effective oil. Kai Triveni oil, and Murivanna also, everybody knows about Murivanna. I'm not going into it. Then you can find many different references of Dhara, many differences of Pilichil or Dhara, or different oil. Rasatailam, Arogiraksha Kalpadharma mentions about this in Panguvada Chikitsa. Tiladailam, simple Tiladaila can be used for Dhara and Shulam. Some local Dhara can be done, where the local Shulam is there, when there is no involvement of Kapam or Amam. Then you can use Tiladaila Dhara. It is the reference there in the Rityoga Tarangani. The Shamura Srata Kshira Dhara, Sabdishula Nivaranam, everybody knows about it. Punarnava Nimba can be used to prepare Thailam, and it can be done in. It is not Punarnava Nimba Thailam actually. You can prepare Kwata with it. Punarnava Nimba. Actually, you can use Shigru also. Shigru as well as Chinja Patram also can be added into it. And that can be boiled, and you can prepare Kwata, and that can be used for Dhara, local Dhara in conditions of Shodham. So that is there. Asanadigana Kashaya Dhara can be used in Prameham. And Vrindamadava is a reference for Gadanigraham for Punarnava Nimba Kashaya Dhara. As I said, improvisation, you can add Chincha Patram and this thing into it. And diluted vinegar can be done for Dhara and the sensory neuropathy. This I have done, and it is found to be very effective in such conditions. So, coming to the famous Dhanyamla Dhara. Dhanyamla Dhara is something which Dhanyamlam is also very specifically used in different conditions. We know that Dhanyamlam is penetrated internally, but it is Shida oil, it is used externally. And it is actually Sandhana Kalpana, and there are different names for it. Aranalam because of the typical smell. Aranalam, the name is because of the typical smell into it. Kulmasham is because of the different kind of material which is being used in the preparation of Dhanyam. Like we know that we use Tandulam, Prudugam, Pulattam, Laja, Kandu, Godravam, Nagaram, Jambiram, Deepagam, etc. in the preparation of Dhanyam. And then Kanjigam because of the method of preparation. Vippugadi is the Malayalam name of Dhanyam which is being used. So it is said to be Amahara in nature, and in diabetes conditions, if there is any kind of burning sensation, can be used for as a Dhara. Even in diabetic neuropathy, you can use this. And every day you must use every day you must use new Dhanyamla. You shouldn't reuse it. And there is an interesting prayoga of Dhanyamla Dhara in Yoga Amrita. It is being said you can do Nadi Svedam of Dhanyamla in conditions of Pratisha and Ardita. And it is said to be Robanam in nature. So any kind of pus-filled wound is there. In Siddha medicine, not in Ayurveda medicine. In Siddha medicine, they have this method of doing Dhara with Dhanyamlam in conditions where you require Robanam in certain pus-filled wound. So such things are also there while we speak about Dhanyamla Dhara. And there is also this condition called, not a procedure called Dhanyamlakiri. Dhanyamlakiri is where you prepare churnam with, say you use Kolebulatadi churnam or Potanjukadi churnam or any kind of Adhara. Churnam is being used to prepare potali, and you boil Dhanyamla, and then you dip the potali into the Dhanyamla, and it is being done for different conditions where there is Amavastha is there. Okay, so Dhanyamlakiri is there. There is also this Avikiri, which is a typical practice in Kerala, where you boil Dhanyamla in a vessel, and then you cover the mouth of the vessel with a cloth. And then you take the potali, you prepare a potali with powder, as I said, and then you keep the potali on top of this cloth, so that the cloth is being heated with the steam generated by the Dhanyamla. And that is used for Svedana. So that particular kind of is also being done in conditions where there is also Amavastha is there. Similar conditions, Amavastha is there, you can do that. And that is a kind of procedure where there is no direct contact of Dhanyamla with the body. The liquid contact is not there, the steam of Dhanyamla is being used. That is actually an improvised method is being used by certain Vaidyas. Then there is local dharas. Local dharas like Yamaga. Yamaga, you can see Taila and Grida can be mixed together and prepare Yamaga, and it can be done in dhara for tricky and painful ulcers. The Yoga Amritam is a reference for that. Ashmiri and Mutra Krisaram also you can do local dhara on the lower abdominal area or the bladder area. So some local dharas, Yamaka can also be done. Then Dhanyamla Prasudha Apamargam, Chincha Patram and Vanatulasi, that is being prescribed in Arshas for local dhara by Chilsa Manjil. So a variation of Dhanyamlam is being mentioned over there. Okay. So different methods of preparation of Dhanyamlam is also there, and certain local dharas. Like I said, while you prepare, if there is any local swelling kind of thing, traditionally we used to prepare certain, as I said, we use Shiburu Patram and Chincha Patram can be used to prepare a Vata, and that can be simply used for dhara also. There is also local dhara which is being used very commonly. Okay. So that is about dharas. So I'm not taking too much of your time because when you are speaking too much about everything, especially on online session, then that will be boring, especially after lunch, everybody must be feeling sleepy. So I would say that we shouldn't go for a long session. A short session is fine and good, I hope. And I think this session would be helpful for many of the young doctors attending this program. And I would like to thank Rajkala Madam and Adil Sir for providing me this opportunity. I can see Adil Sir here, and I remember our Jamnagar days, and I'm very happy to be a part of this program, and thank each and every one of you for patient listening. Thank you so much.
Thank you, Dr. Praveen. It was a wonderful presentation, wonderful lecture. Like a cool and calm demeanor, if you have the presentation and the topic also had a very soothing effect on all of us. Definitely, all the aspects, the modern aspect, the Kerala aspect, the classical Ayurveda aspect, and the scientific aspect were equally covered wonderfully. It was a beautiful presentation, beautiful lecture on this wonderful platform of sharing knowledge. Thank you. Most of the audience, most of the listeners must have definitely gained a lot through this wonderful presentation of yours. Now, if any one of us, from the audience have any of the questions, they can put their questions in the message box, in the chat box, and we can, and Dr. Praveen can answer those questions. And always wonderful to see you. And I take pride, personally, I take pride and feel very happy watching you in doing such a wonderful presentation. Very happy for you.
Thank you. Thank you so much. Thank you, madam. Thank you, madam.
So once again, I'd like to thank ma'am for providing me this opportunity to thank Dr. Praveen. He has been a wonderful junior. Now, Damayanti has asked, which is the text sir referred? Please be more clear, Damayanti Fernando, if you could be more clear, for which in chronic dandruff, which dhara is best? Vikas Pandit has asked a question. In chronic dandruff, which dhara is best?
Yeah, so regarding the textbooks, two textbooks which I have referred mostly. One is the Siresegadi Vidhi by Putiyadatta Raman Menon, which I said, which is a new kind of textbook regarding Dhara Chikitsa. It is available, it is published, it is available in the market. And if anybody wants to read more about this small book, it contains maybe less than 100 pages. And the other one is obviously Dhara Kalpam. Everybody knows about Dhara Kalpam, but if it is possible for you to get a copy of Siresegadi Vidhi, it is very effective to understand Dhara from a different perspective. Those are the two books we would recommend. And regarding the chronic
Dandruff.
Chronic dandruff, you need to see actually what kind of, as I said, the avastha of the patient should be, avastha of the patient as well as the avastha of the roga should be assessed properly. And usually I advise Durdura Patradi Geram. That is something which we advise. That is very effective for simple upping is enough. I don't think that the dhara is required for that. And Durdura Patradi would be very effective for managing dandruff.
Thank you, Dr. Praveen. Shaheti Rathi has asked you, sir, can you please repeat the name of the book?
Yeah, I would repeat the name of the book, Dhara Kalpam, which everybody knows about. The other is Siresegadi Vidhi.
Siresegadi Vidhi.
Siresegadi Vidhi. Yeah, Siresegadi Vidhi by Putiyadatta Raman Menon. There is English explanation is that for that book also that is available. It is written by Dr. M. Prasad. That is available in the market. Okay.
She has expressed her thanks to you. We all are thankful to you, Dr. Praveen, for this wonderful presentation of yours. The coverage was wonderful. The presentation was wonderful. It was very timely presentation. And I personally know your cool and calm demeanor. Your personality has always been very cool and calm, producing a cooling effect like the Dhara effect. So the presentation was also very soothing. Thank you once again, Dr. Praveen, for this wonderful presentation of yours, for your time out of your busy schedule. Thanks a lot. Thank you so much. And on behalf of Faculty of Ayurveda, Faculty of Panchakarma, and on behalf of Rajkala ma'am, I thank you once again. Thank you so much.
Thank you, sir.
God bless.
Thank you all the audience for patient listening.